Welcome to our fifth video in our Boost Your Rehab series. Today we're talking about fragility and anti-fragility. We started off our series with the question, why do I get pain? So after watching the previous 4 videos, if you haven't already, make sure to give them a watch. After watching these, you might be able to answer that question, at least theoretically. So in your head, you now know why you get pain. However, in your heart, you might still blame yourself or your body. You might still feel fragile, injury prone, or have the feeling that your body is actually failing you. And you don't feel like that Hydra that positively reacts to stress. You feel more like Achilles, who has a very specific weak point. So you don't feel like your body adapts to stress by building calluses, by growing stronger. You feel like you always end up with blisters. And if you feel like that, I think that's a shame, because we have so much evidence that we as humans are so anti-fragile. We are so adaptable. We can adapt to almost any adversity. So how come that you still feel like you are fragile, that you can't tolerate physical activity, physical stress, or any other form of physical activity? Why do you feel like you get injured so fast? Why doesn't your body seem to adapt, or at least not positively? Well, there can be a couple of scenarios that cause you to feel or to make it seem like your body is actually quite fragile. And I want to tackle these 4 scenarios in this video and tell you how you could possibly deal with that, so that you can regain that confidence in your body and actually start building back that bigger cup. So the first one we already talked about in the last video is when your system is just too sensitive. And this can happen from a very overprotective environment or from negative experience. There could be many reasons for your system to become overly sensitive. Now, this becomes worse if you start paying a lot of attention to every alarm that goes off. So now you become paranoid. You become hyper focused on that pain and it becomes paralyzing. How are we going to deal with that? So we talked about this graded exposure last time. We're slowly going to expose you to the things that hurt. But the thing here is that if your system is so sensitive, you might get some reaction from anything. So even from the first step. So the important message here is just start doing something even though it hurts, even though that traffic light is on red. Be sensible about it. So don't do anything stupid. Start slow. Start with whatever you consider step 1. And even though you might get a reaction, even though that alarm goes off, that pain signal is there, start there and give the body time to react, to adapt, to relax. So the thing here is, if your body is oversensitive, gives pain signals very often or very intense, just start slow, accept that that alarm is going off, that the pain signal is going to be there, start there, stay there, and give the body time to react, adapt, and relax. Now the second one is where you actually are fragile in a sense, because you keep going into every activity with a very small cup, in this case an espresso cup. Like we talked about in a video, this could be because you are very stressed, because you don't sleep well, because you don't have enough daily physical movement, or you have bad nutrition. There could be many reasons for this. But if you have low general health, then your body might not be able to tolerate stress exposure so well. And if you have these things working against you, it's almost like putting a plant in a dark room. You could water it, you could give it all kinds of special powders. If that plant is in a dark room, if the situation is not suited for recovery, for growth, it's not getting any better. So how do we tackle this? This is actually quite simple, but it's pretty hard. So simple and easy are not the same things. It's not complex, it's just hard to do. Eat healthier, maybe lose some weight if that is an issue with you. Sleep better, sleep more, move more. I'm not talking about exercise, just general movement. Taking the bike instead of the car. Manage stress and build in anything that can help you relax. So working on your general health can help you tolerate stress better and become less fragile. So the third one here is that if you always have an on or an off switch, you're going all out or doing nothing at all, this might cause you to get injured very often. You want physical activity to be more of a damper setting, which decreases very slightly and modestly, or could decrease ever so slightly and modestly. So you don't want any contrast here. If there's anything your body doesn't like, it's very big contrast, going from nothing to everything, from black to white. So like I said, we want these small steps. If you feel like every time that you start, you fall all the way back down, the problem might be that you're taking too big leaps instead of taking these small steps towards your goals. No on or on switch, but use that damper setting. Gradually increase, gradually decrease. Make slow, small, steady steps. Now the fourth one is a quite tricky one. So it could be that something is actually going on inside your body. And we want to take this seriously, but I also want to shed some positive light on the situation. So the first and most important thing here is that might not be the doom scenario that you think it is. We see all kind of abnormalities on scans on people that have no symptoms. So you could see people with disc bulges, disc degenerations, meniscus abnormalities, labral tears, or shoulder injuries on a scan. However, they live their life without symptoms, meaning pain-free. So the fact that you have something going on doesn't mean that you have to be fragile. It doesn't mean that you are doomed. But we are going to take these things into account. We're not just going to ignore it. I just want you to have a bit of a more positive view on the situation and see yourself as more adaptable and anti-fragile instead of just very fragile because there might be something on your scan or you might have gotten some diagnosis. Because all this means is that there is firewood. It doesn't mean that there is fire. That depends on how we are treating that firewood. So are we getting it very dry? Are we having flammable objects nearby? Or are we keeping it wet and even allow it to flourish? Like you see on the right side. So if you have something going on, if you have a diagnosis, is that more or less reason to look at a cup analogy, to look at our recovery capacities, to be mindful about how much we're pouring into that cup? So we are not doomed in this scenario. It is just that there is firewood, and the way we treat that firewood, which is no different than anything else we talked about in the cup analogy, that is going to determine if it is going to actually catch on fire or that it stays wet and that we are still going to flourish. It just means that we might already have something inside our cup and we're going to take that into account with everything that we do. This doesn't stop us from building a bigger cup and managing how much we're pouring in. So, I hope with these 4 things I shed some positive light on the situation. And now that you know these things, you might have a better understanding of why you might feel fragile, but most importantly, you know how to deal with it. Now, to sum up this series, we're going to finish off with the last video, the 6th video of the series, where we are actually going to bring this all together and draw some conclusions here.